My name's Laura Triggs. I'm the Antimicrobial Stewardship and Infectious Disease Pharmacist at the Canberra Hospital, and my team is the Antimicrobial Stewardship team. It's in a metropolitan area and we're a major referral centre for the south coast of New South Wales and regional New South Wales. Antimicrobial resistance is a global health threat, and the antimicrobial stewardship team within hospitals and the wider community is a crucial role to combat resistance. We set out to ensure that our patients were prescribed the most effective antibiotics for their infection. We audit every year and we recognise that our hospital, we weren't following the national guidelines as well as we should for our patients. So to improve safety for patients and improve antimicrobial use for patients, we decided to implement more frequent audits to capture the data and actually understand what the problems were. We really wanted to implement these audits so that we could make change throughout the year rather than waiting a whole year to see if our interventions had impact. We wanted to do more for our patients. Antimicrobial stewardship is an exceptional initiative that we all are part of, but the more we do, the better the outcomes. Commission has this antimicrobial stewardship clinical care standard auditing tool that allowed us to capture the data and generate reports. And when we looked at those reports month to month, we saw different trends and certain areas that we could target, and those being antibiotic allergy prescribing, use of guidelines, and inappropriate prolonged surgical prophylaxis. So a lot of patients come in with a penicillin allergy, and what the audit identified was that we weren't documenting these allergies appropriately and we weren't asking our patients the right questions. What we found was if we were asking the right questions, we were able to identify patients that were deemed lower risk for a challenge. So what that means is giving them a low dose of a penicillin, observing them for a period of time in hospital, and then subsequently delabeling their allergy. I think initially with the antibiotic delabeling and allergy service, clinicians on the wards were a bit sceptical. We felt it was really important to get a policy so that there was a document that actually had a structure to it. We identified an area where the prescribers weren't using high-risk medicines, which are certain antibiotics that are exceptionally good for infections. And the reason they weren't doing it is because they were worried about toxicity. We then implemented a pharmacy-led monitoring service where we took drug levels from the patient's blood to monitor the exposures of those antibiotics so that the prescribers could, with confidence, prescribe those medicines. So then we're using first-line agents that are going to treat their infection much better than the second-line agents. With patients coming in for surgical procedures, antibiotics are crucial to prevent infections at the time of incision to ensure that there's a concentration in the blood to prevent infection at that surgical site. Now, we were seeing a lot of patients were prescribed antibiotics for a number of days following the procedure, and we engaged the actual prescribers that were in the surgical teams. Then engaged the executive director of surgery, who then set up meetings with the different heads of the surgical departments. And I think having that top-end approach was very important because ensuring that the whole division is on the same page is really crucial. And we saw with the interventions about surgical prophylaxis that we were able to reduce our surgical prophylaxis rates, so reducing the use of unnecessary antibiotics after that surgical period. A number of different key things that we've picked up on the way. Teamwork is crucial, particularly in this initiative, the ward pharmacists, they were the ones that were collecting all the data and seeing the changes made and having the conversations with the prescribers. So I think ultimately in a project like this, ensuring that you've got really strong foundations of teamwork and communication is crucial. Another key learning I think is closing the feedback loop. So ensuring that all the key stakeholders that we've engaged throughout the process are well informed at each point in the different cycle. So to allow the prescribers and pharmacists and nurses and everyone working in the hospital, sharing the data with them was crucial so that they understood what these initiatives were working towards. And the indicator monitoring tool was a big part of that to ensure that we could generate reports for distribution to our different levels of governance in the hospital. I think the big nutshell of antimicrobial stewardship is all that we're doing is trying to reduce resistance. So anything that we do that reduces unnecessary antibiotics and gets patients on the directed, correct therapy is going to achieve that aim. And whether that's just one patient, I think that adds up over time to have a worldwide impact.